Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you for joining us today on Facebook Live. This is where, as always, you can get all of your COVID questions answered. Today is Tuesday, May 25th. And you are able to put questions directly into the box below, or you can use the hashtag AskDrArwady on Facebook or Twitter. We were talking just before the show, and for about 2 weeks now, I have been on Twitter. So you can follow me at Dr. Arwady, and we've been posting some of the things we've been doing through the day. We have a special guest here with us today. This is Chris Brown. He is the commissioner at Chicago Public Library. And he is here partly because we are announcing the winners of a library contest, and partly just to talk about COVID and how it's affected the library and some of the ways that we, have been working together. So you'll be able to put in questions for me or questions for him. So welcome.
Thanks for having me, Allison.
Yeah, thanks so much for being here, and it's been just great working with the libraries throughout this. For those who don't know, the main branch of the Chicago Department of Public Health downtown is right sort of kitty corner, right across the street from the Harold Washington Library. And so we've done a lot of stuff. They have some big spaces in the library, so we've been able to use it for vaccine operations center. We've really been partnering in a lot of ways, but then especially when we think about getting information out. So I know you came to this role fairly recently.
Yeah, from like sunny California. Moved in the middle of winter, so got in the middle of a snowstorm, literally.
Nice.
And in the middle of COVID, so.
Always an excellent time to start a job, yes.
Yeah.
So what was that, February?
It was beginning of February.
All right. Well, welcome.
Thank you so much.
Every day is probably getting better for you then, not just from a COVID perspective, but from a weather perspective.
It all feels so much calmer now,
yeah.
And I'm so glad that I feel like we're turning this corner as a city. And,
yeah.
I'm just so glad that the library could participate and support Chicago learning more about getting the vaccine and the importance of it.
Yeah, absolutely. So before we get into that and into the data, tell us just a little bit about the libraries and how COVID has impacted and some of what you've had to do with your operations and how you're doing now.
Well, our library is so proud that we've been able to serve the city of Chicago really throughout the pandemic.
Yep.
So our library buildings have been open since last summer.
Which is impressive, because lots of library buildings were not.
And we've been serving up to 300,000 visitors every month.
Yep.
So people, they need to access those digital resources.
Yep.
They need to connect with jobs. People are distance learning or they're back in school.
Yep.
They need those educational resources. And our staff, they've just been stellar, showing up for this city and keeping Chicagoans connected.
Yeah. And are all of your libraries open at this point?
I think we're at 74 out of 81,
okay.
So we're pretty good.
Yeah.
The only ones that aren't open are the ones that you can't socially distance in.
Got it.
So you don't want to be there anyway.
Got it, yeah. And I know, there's been lots of work all throughout this, looking at the social distancing, and obviously when vaccine came in, really wanting to make sure staff had opportunities to get vaccinated, and then,
absolutely.
And then part of why you're here today is because we're announcing a contest.
Well, it's so important for Chicagoans to know the science, to know the data. And our libraries are in every neighborhood of our city. Chicagoans have personal relationships with our staff. They're people that they come in contact with in person, face to face. So being able to get involved, to have our staff be able to share data about the vaccine, they wanted to get involved and support our city, so they created displays to promote everyone getting vaccinated, and we have some of those to show off today. Some of them are very inventive. They made me crack up. Yeah.
Yeah, so you can go into a branch near you. Obviously, a lot of people get their information from their doctor's office, et cetera, but we know a lot of folks are coming into the library. So we are going to show some of those in just a minute. But in the meantime, let's take a look at some data. You can start putting in questions for me or for the library commissioner, and we will get right to those. So first, let's turn to our data. Sorry, just switching up here. There we go. So as always, chi.gov/COVID- is where you can get the latest on vaccine data and COVID data here in Chicago. If you weren't with us last week, you'll see that we've done a really nice upgrade to our dashboard in partnership with Slalom. And so the news is really continuing to look very, very good from a COVID perspective. You can see we're averaging 256 cases per day right now, and that's down 17% just from a week ago. We were still over 300.
Right.
So that's been going down every day. You can see that graph trending exactly the way we want it to, and that's with reopening. So we've been really pleased to see that. And obviously, we continue to see this trend. We'll be turning that dial some more, planning to do some more reopening. Our hospitalizations also have really decreased. You can see where there's about 13 Chicagoans getting newly admitted to the hospital every day with COVID, but that's down from 26 a week ago. So heading the right way. We still do have 5 Chicagoans dying every day from COVID, but that's down from 7 or 8 a week ago. So everything, going the way we want it to. And our positivity is at 3.0%. So very happy to see this. The last time we were seeing case numbers and positivity numbers like this was in February. And so it took us about 3 months to get back there, but everything is heading well. And the main reason for this is because of this vaccinations number. You can see we're averaging between 14,000 and 15,000 vaccinations a day, which is pretty good. You can see, we peaked in late April and then have been seeing some decline. But then for the last few weeks, it's been pretty stable. A lot of kids getting vaccinated, which has been good to see. And we are now past the point where more than half, 50.4% of all Chicagoans have gotten at least one first dose, and that's really exciting. I'm going to look here, and you can explore if you want to look more at cases. You can look by race, ethnicity, if you want to see more about hospitalizations or deaths, if you want to look by age, if you want to look by zip code and see exactly what's been going on, either in the most recent week or cumulatively with testing or positivity or deaths or cases across Chicago. If you want to see more details about testing and learn more about that, that's here. And then our vaccine really starts to break some of this down. So just over half, like I said, of all Chicagoans have gotten a first dose. If we limit that to adults, those over 18, we're now at 62% have gotten a first dose, which is good. That's really right at the national average. Our goal is to get to 70% of all Chicago adults having had a first dose by July 4th, if we can get there. That's the national goal. It's our goal in Chicago. And this has been ticking up nicely every day. And finally, I'm happy to say for 65 plus, we're going to round up a little bit. We're at 69.7, which is close enough, and we'll probably pass very shortly here 70%. So glad to finally be at 70% with those over 65. And if you look at the completed vaccine series, half of Chicago adults have completed their vaccine series.
That's awesome.
So that's really good. We're making good progress. All right. And then again, if you want to look here by zip code, you can explore and see, for example, I can slide this over and show you, these are the zip codes in Chicago that more than half of the whole population, not just the adults, have gotten a first dose. If we look where 40%, right? At least 40% has. And these in the light color here, where we're not at 40% yet, those are the zip codes that are now our Protect Chicago Plus communities, the ones where we're doing additional vaccine outreach, really bringing a lot of vaccine, really door-to-door, to events, working to really lower barriers to vaccination.
We had a vaccine bus at North Austin.
Yes, you did.
I thought that was so great.
You
At
did.
our library, vaccine bus there, people can get their stuff and get vaccinated.
Exactly. Yeah, libraries have definitely, they've been one of the more popular places for us to, have the vaccination bus stop off. So yes, everything really heading the right way. And I encourage you to please explore this data, send in questions that you have about it. So let's go ahead and turn right away to the contest, all right? I'm going to turn this into a slideshow. So first of all, just as a reminder, appointments are available for anybody age 12 or over. You can book an appointment at zocdoc.com/vaccine, or you can go to our vaccine finder, chi.gov/COVIDvax, but you can also call 312-746-4835. You call that number. We've got people staffing it, a couple hundred people staffing it 7 days a week. They will talk to you and sort out whatever your problem is with vaccine. They'll figure out transportation. If you're over 65 or you have a disability, we will bring vaccine right to your house. And we had a lot of people sign up for that in the first week, which is great. If you want to know where can I get a particular type of vaccine, we'll sort that out. If you need to know, I got my first dose out of state, where do I go now? We will help solve all of your vaccine problems if you give us a call. So really, you don't need to make an appointment. The great majority, all of the city sites and many sites around the city, you can just walk in now and get an appointment. So if you're at a pharmacy, ask and see if they have vaccine available. A lot of the grocery stores with pharmacies, Mariano's, Jewel's, etc., also have vaccine available. Walmart does, obviously Walgreens, CVS, some of the smaller independent pharmacies. Many providers, so doctors' offices, hospitals, all across the city. And then this week alone, we're doing 48 pop-up events. So between the vaccination bus, things at schools, things at churches, there's a whole lot happening around the city, and you can find it all at chi.gov/COVIDvax or give us a call. Okay. We are turning to the contest. So I'm gonna let you kind of talk us through just a little bit about the branch and.
Oh, so this is our Beverly branch in Southside Chicago. Just inventive staff, you know, putting fun attention, getting displays together. We got our giant mask that they somehow created, as well as books, so you can read more about vaccines and.
I like the vaccinated frog down there.
I was wondering,
with
where
the
do they
Band-Aid.
get that?
That's very nice. Here we've got the Edgebrook branch. Give it a shot. Pulling together information. First, wear a face mask. That's where we started.
They're cracking me up too. Like, where do they get these graphics from? But very inventive.
They're creative.
In this one, I don't know where they got the life-size cutout of Dr. Fauci, but somehow we have a hookup.
I like it. I like it. There's a life-size cutout of me that hangs out at some of those vaccination sites, but I prefer.
I think
Dr.
you're
Fauci.
at Harold Washington.
I am at Harold Washington. Yes. Here we've got some more books, mixing in some of the staying healthy with the COVID ones generally. Here we're fighting boredom and COVID by reading.
And I love some of these too, because we're getting also these like picture books out to parents and kids, because it's a stressful time for families, right? So just getting them something to read as well as making sure that they learn all about getting the vaccine.
Yeah, and I'm an adult doctor and a pediatrician by training, and I think it's so important actually to talk to kids about COVID, even the young ones, and books are a good way to make sure you're having that conversation. Here we have a penguin dressed up as a doctor.
I don't know where the penguin came from, but they found a jacket that fits the penguin.
Yes.
So I also don't know where that came from.
Ask me about the COVID-19 vaccine, the
Very
penguin
creative.
says, and we've got some pandemic stuff here. All right, here we've got the panic virus, more about just books you can read. And it's interesting. I really love taking books out online from the library, and all the books about epidemics and outbreaks. Normally I'm like the only one who wants to read those, and right now they're all on. You
could have like your own book club.
I could.
People are into it right now.
Exactly. All right, here we've got Mean Gene says, get your vaccine, which is
Pullman Branch Library. Yep.
WWE.
The Mean vaccine.
And Bazazian Branch, take good care.
Just reminding people. I also like that they put in books about calm and mental health, right? Even going beyond vaccines or viruses, also just wellness. Yeah. People making sure that they're taking care of themselves.
Absolutely. And then here's the Northtown branch. Again, a lot of the kids' books. Lots of books come out about vaccines and multiple languages. Logan Square. Again, a nice, English and Spanish. Lots of stuff available in other languages, I know. Okay, we're coming to our winners. Third place.
All right, so third place goes to Bucktown Wicker Park branch. And just playing off the whole Dr. Seuss theme, so inventive, just really colorful. Our staff are so creative.
Yeah, I really like this one because this is kind of what we're going for with vaccine. It's
right?
very positive.
Get vaccinated.
The reason you get vaccinated,
because we're going to go somewhere.
You're going to go somewhere.
It's going to be exciting.
You don't have to do the travel order anymore. You don't have to test. You don't have to worry. So I like that one a lot. Playing off the Dr. Seuss. All right, second place we've got
Harold Washington
Saving
Library.
Chicago.
So our central library. Don't wait. Get vaccinated.
And I know this is one where they've been pulling together little objects from throughout the pandemic, and they're planning to do something to have people contribute and sort of think about, creating something historic.
And that message too of, we're also trying to look out for each other.
Yeah.
Right. We're trying to keep our other fellow Chicagoans safe.
Yep. All right, and in first place,
the Richard M. Daley. I love this one. Hilarious. You know, as someone who grew up with salt and pepper,
yes.
Let's talk about Vax.
Let's talk about Vax, baby. Exactly.
Careful, you may end up in like a little a little music video.
Yeah. So I like this. Let's talk about Vax and all the details. So first place, Richard M. Daley branch. But really, thanks. Thanks to everybody at CPL, and really to everybody who's been sharing good information about vaccines. We've been promoting our vaccine ambassador course. We've seen a lot of people take it. I know there are librarians and other staff at the library.
So they can guide people to resources.
It's perfect. Yeah. It's perfect. And if you want to also take that class, we set it up through City Colleges of Chicago. It's completely free. You get a certificate when you're done. It's at ccc.edu/vaccine ambassador. And it's designed here in Chicago, giving you information about how to talk about vaccine with people. So, okay, thank you. So congrats to Richard M. Daley branch. Let's go ahead and turn to questions. Pull this up here. Okay, lots of things coming through already. Some for you, some for me. So let's start with one for you. Lizzie Red is asking, what services have started again? Will there be summer activities?
Well, Lizzie, thanks for asking. Well, I think as part of the city, we're reopening. We've returned our hours to pre-COVID hours.
Okay.
So our branch hours are back to normal, and then we're at, again, 74 branches that are open. Mm-hmm. We have a whole suite of events and programs for summer. Our whole summer theme is going to be around art and art making. So you'll be able to pick up your activity guide. You actually will be able to get in that guide a free pass to the Chicago Art Institute.
Cool.
And then what's also cool is because we have the Obama portraits up there, you can also pick up a copy of the book Parker Looks Up, which is the whole story about a girl going to go see the Obama portraits herself. So lots of fun activities for Chicagoans at the library.
That's awesome. All right, Faye State on Facebook. How long will the United Center, this one's for me, be giving first Pfizer shots? Are there other drive-thrus that give Pfizer shots? Okay, so the United Center, yesterday was our last day of the extended walk-in operations that were really supported by the federal government. So that was initially planned for an 8-week engagement. We actually extended it another 3 weeks because it was so popular, and we did more than, I think, 280,000 vaccinations there already. And so we did close the major walk-through portion. However, the drive-through, we are keeping open for another month through June 24th. You can go, again, you don't need an appointment. If you want to make an appointment, go to zocdoc.com/vaccine. And we are, through the drive-through, doing both Pfizer and Johnson & Johnson. So you can either get your one shot and done with Johnson & Johnson, or you can get your Pfizer. I actually went and drove through myself yesterday because I just wanted to sort of see how things were operating, and I wanted to be there as that transition was happening. Yeah. Really, really smooth operation. Not big lines. There were certainly cars, but you pull right in. They were very set up, and you go and you give your information, and then they move you along and answer any of your questions, ask if you have any history of anything, take your records, give you your card, give you your information. They vaccinate you without you ever having to get out of the car. And in fact, they like to keep people in their cars. If someone has to go to the bathroom, of course, they'll accompany them. But the idea is you stay in your car, and they'll have you, right arm, left arm, move around wherever's necessary. And then you pull through and you do your either 15 minutes or 30 minutes of waiting. And there's, when I was there yesterday, there was someone who works as a paramedic, is his other job. And, they just walk and talk, chat with folks, make sure nobody's having any issues. You're able to drive right out. So the whole thing is honestly, less than half an hour in terms of being able to move through. Yeah. And so, I'd encourage you, if you're someone who's been, concerned about distancing, you don't even want to get out of the car, this is a great way to go and get vaccine. And we are going to keep it for another month. And thanks to, the many partners who are making that happen. So those will continue to be there. Other drive-throughs, you can look on ZocDoc. Chicago State University down south is also doing a drive-through right now. Okay.
We're removing all the barriers. You're even testing it out yourself. That's awesome.
Yes. I was already vaccinated, but I went through and I like being a blind shopper.
Yeah,
so yeah. I showed up and they really did a great job. Okay. Jorgensen Yolanda on Facebook is wondering, what's a good statement to counter a vaccine-hesitant adult who says, we don't know the long-term side effects of the vaccine? All right, I'm going to start with the long-term side effects, and I don't know if you have any other thoughts about, communication or anything. Feel free to chime in. So when people ask me about long-term side effects of the vaccine, I usually start by saying, first of all, there are no vaccines that we know of that have long-term side effects. So there are vaccines that we have studied for years and years and years and years and years, right? The measles vaccine, the flu, vaccines are not, when they're approved, they're not known to give long-term side effects. Where we really are concerned about side effects is especially right at the beginning there. And then typically where you see a problem, it'll happen in the first couple of weeks, even with a brand new vaccine, when they're studying it. Very, very, very rare to have anything coming after that time. And in fact, that's part of why the FDA wants the 6 months of monitoring, because if you've monitored somebody for 6 months afterwards, really there's no biological reason that you would expect there to be any long-term concerns from the vaccine. So, already based on what I knew about vaccines, I wasn't worried about the long term. And then in the studies, they have followed people now, everybody who is in these studies, like for Pfizer, for example, full follow-on for more than the 6 months, which is why they could submit that information to FDA, and that's why it's being reviewed right now for the full authorization. That was one of the requirements for the full authorization. But there are no links with fertility. That's one we hear a lot about. Again, for this or any vaccine. There's never been a vaccine linked to fertility problems. There was no reason to think this one would be either, and we've not seen any issues with that. It doesn't affect the placenta. It doesn't affect, these are some of the questions we hear. So really, it's not a vaccine that hangs around. When you get the vaccine, it does not interact with your DNA. That's a question we sometimes hear. And in fact, it's literally gone just within hours to days, but it has taught your immune system how to fight off COVID. So anything you want to add to that?
You know what was so funny? I had a staff member actually tell me, hey, after we talked last week, I went and got the vaccine. I have no clue what I told them, but I think we were just talking about how important it is for us to be part of this solution for the city.
Yeah. And I think, one of the things just off that is that sometimes people feel worried about, should I talk about getting the vaccine or should I talk about the vaccine? I'm not a doctor. I don't have all the information. The most important thing, honestly, is to have the conversation, to start that conversation. And so, even if you're not the expert, if you're creating that conversation. And what's been interesting is there's now been some studies that have shown one of the things that is most predictive for someone who maybe doesn't raise their hand first is multiple opportunities and multiple conversations. I read an article that was talking about actually in the California prison system, whether people, they offered COVID vaccine to everybody, and almost 2/3 of the inmates said, I want the vaccine, the first time around. But then, coming back around, having more conversation, almost half again with multiple opportunities said, they were interested. And so this doesn't just apply obviously to a prison setting, like a workplace setting, a family. There are people who are not first. They want to say, I want to see what happens. I want to see my coworkers. I want to see my friends, my family. But keeping that conversation going is really critical. So, I'm glad you're having these conversations.
Well, I think it's like anything new, right? Like people just need to hear it over and over, or seeing their coworkers or their family get it. I think it's just normalizing it.
Yes, absolutely. I totally agree. Okay. Tam is wondering, what is at the Harold Washington Library? When can the public be back in the Winter Garden Room? I know the answer to that, but I'm going to let him take it.
Well, the Winter Garden Room is currently our vaccine operations center with the city. So hopefully when things improve and that site opens up. Well, we have 10 floors at Harold Washington, 9 for the public. And so really, you gotta come in and sort of digest it piece by piece. We have our popular library on your ground floor where you can just sort of pick up all the newest reads and get your hold sent there. All kinds of stuff, floor by floor. We also have a science floor, so for those people who want to read more about vaccines and get more information on them, they can go there as well.
Yeah, perfect. And yeah, we We have been using the Winter Garden Room, I will say, but we absolutely, hands down, have the most beautiful, but also the best spaced, very centrally located. It's been really such an important space because it's not just Chicago Department of Public Health folks who work on this vaccine outreach. It's been people from across the whole city. And so, like I said, we've been using some of the larger spaces, and really with the full operation, really so grateful to the library for letting us use that space. It is a lot of work to run these operations, and that's been the partnership. But we won't be there that much longer, so no worries.
Good to know that someone wants to get back in, though.
That's right.
Yeah.
That's right. Okay, so Adam, 1974, what are you doing to reach the elderly to encourage vaccination? Do you have a lot of older Chicagoans who come to the library?
Well, I think libraries in general, we're very popular with our senior communities.
Yeah.
I know when I am retired one day, I'm going to be enjoying all that reading myself. So we do have a lot of our senior communities that come into the libraries and are sort of some of our most devoted users.
Yeah, exactly.
So yeah, they're definitely in there.
Yeah, we've been thinking and talking to a lot of folks. Where do folks who are older, perhaps if they've been at home a whole lot and they're starting to come out, where is it easy to reach groups? Where do people come a lot? And so we've been thinking about senior centers, obviously, and places like libraries, but also churches and synagogues and other religious settings. So, for example, we had a faith month, we had a senior month, and we had a faith month, but we've been doing more with churches in particular. So like this last Sunday, we were at 6 different churches, and they vaccinated, more than 300 and close to 350 people, 50 to 60 people at these services, and going, and they talked about vaccination at the churches, and then had it available right on site. And a lot of those people were older. So number one. First, we brought vaccine to anywhere where seniors lived. So any senior living, any supportive, anything where there were a lot of seniors, that's where we started. And then we expanded to any sort of supportive housing, but also really worked for folks who are homebound first, but then now, like I mentioned, anybody over the age of 65, you can call our number. If you're a Chicago resident, we will bring vaccine to your house. You can get Pfizer, you can get Johnson & Johnson. We schedule it, we come with identification, and really trying to make it available. But most older Chicagoans have been vaccinated through their own doctor or their own hospital.
I think that's so great too, just not even for those folks who are seniors, but also people who have accessibility issues.
Exactly.
The fact that they can still connect and get that vaccine, that's phenomenal.
Yeah, that's really, and that's our best practice. That's our long-term practice, where you think about where you typically get a vaccine. You get it through your doctor, your hospital, your pharmacy, and that's where, as we start to move kind of toward the second half of this year, those providers where people are coming in to get their primary care, that's where we really want to make sure a lot of vaccines plugged in. Okay. Let's see. Alexandria Dean on Facebook is saying, I read something about myocarditis in young adults, possibly related to vaccination. My child is set to get his second shot soon. Should I be concerned? Have there been such reports here? So no, there haven't. So what this is a comment about is that, as always, the CDC and the manufacturers, we monitor anything that happens in anyone post-vaccine. At this point, there has not been any link between the myocarditis and the vaccine. And in fact, the rate of this myocarditis that they've seen has not, myocarditis is a heart issue. It's not been higher, it's not been linked, but it's been one of the things that, younger people very occasionally can get. And so, we've advised physicians here, if they were to see that, to make sure that they're reporting it. But your child should absolutely get the second shot. We will certainly let you know if there's any sign that this has been linked in any way. But we've not seen reports of that locally here. We have asked doctors just to be on the lookout if we were to see it. But this is not like when the J&J was paused. This is sort of a, more of just a be aware in case we were to see anything. But I don't have any concerns about it based on what we've seen at this point. Okay. So let's see, lots of things here. Okay, let's take this one because it's quick. Joan Rat K on Facebook. I'd like to know when the indoor Chicago public pools will be open to vaccinated seniors. They're allowing team sports, but no seniors. They are open now, actually. So the indoor Chicago public pools are open to anybody, but also especially to vaccinated seniors, but you got to sign up. Fridays at 9 a.m. is when you go online and you can sign up for the whole week. You sign up for an hour at a time. It's one person per lane. If you're not able to go online, call the pool and they'll help get you sorted. But you can sign up, and lap swim is definitely open again. And in fact, Chicago Park District has planning a full summer with pools, with beaches, the lifeguards, the whole thing.
Look at that, good news.
Yeah, it is good news. Okay. Here's a library question. Do my kids need a mask at the library?
We all still need masks, yeah.
Yeah.
Just because we don't know who's been vaccinated yet.
That's right.
And so I think it's just a precaution to make sure that we're all protecting each other.
Yeah, and I'll just put a little bit of a finer point on that. So right now, we're not in phase 5 yet. We're not fully open. We've dropped the requirement for masks for vaccinated people, but children, and if this is a young child, would not be vaccinated yet, and so they should still wear a mask. And then also in this in-between period, we have advised that unless a setting is going to be checking or asking about vaccination status, really to keep the masks as we're still sort of seeing these numbers come down. And we specifically said City of Chicago buildings, we're keeping the mask. This is not forever at all, but until we get to phase 5. And so, yes, in the library or in any of the city buildings at this point, we're still wearing masks. And getting to that 50% of adults vaccinated is a good step there. We're making good progress. Okay, let's see. Trying to decide which of these to take. Okay. Let's take Super Duper 31. How do you decide where to put vaccine events? It's a good question. And we do this very much from a data perspective. So I showed you earlier, those 13 zip codes, largely on the west and the south sides, that are least vaccinated. Less than 40% of adults have gotten a first dose. Those are geographically, as part of Protect Chicago Plus, where we're putting extra efforts, right? It's where we're routinely sort of sending the vaccine bus. So you said we were at Austin Public Library. Yep. We've done some of the block to block. We've been really working to, knock on doors and do what we can in those areas with extra focus. But we do events really all over the city. And it's about where can we pull, a good number of people together. So I mentioned, these churches around the city. But if you can get, at this point, if we're doing, 50, 60 people, that's a very successful event for the bus. And so wherever there's sort of going to be a congregation of people, I don't mean just religious, but there's going to be a group of people coming together, we'll look at that. And this is really every single week we're looking at our data. And we don't just look at the zip code. That's what's available online, but we have it all the way down to the census tract. And so the census tract is just like a few blocks. So we can say within a few blocks, where do we need to go? Where do we most need to focus? Obviously, with Chicago Public Schools, we've been looking a lot about this, deciding, where to put efforts there, working. There's a lot of stuff happening with them. We're going to be out again with, with the vaccine bus at, I think, 5 schools this Saturday. And, I've been seeing a lot of people turn out with their families for that. I'm going to just note, we had an MMWR, that's the Morbidity and Mortality Weekly Report. It's the CDC weekly journal. It's like the main thing that people in public health read. And Chicago Department of Public Health had one come out maybe 2 weeks ago that was actually more about our community-based testing, but it was highlighting, and I refer people to it if you want to take a look. Maybe we'll post a link in the chat. It was looking at our community-based testing, and because we used a very similar strategy where we have a couple of, at the most we ever had was 6 fixed sites that the city was running. In addition to all of the testing that was happening, through clinical sites, there were 6 fixed sites and then mobile sites. And then as we got better, we dropped that down so there's not as many fixed sites. But every single week we would look at our data and again, sort of census level tracked, where do we need to push mobile vaccination efforts? Where do we need to bring testing to make sure that people can access it where we're potentially seeing it surge? And with that, we were able to show that actually the community-based testing, meaning what CDC CDPH, with CORE and others, what the city was sponsoring, was the most successful in terms of having the highest percentage of positivity. And if you think about it, a high percent of positivity means you're catching the most people with COVID, right? So whereas across the whole city, all of the other sites, the average was about a 7% positivity. Where we were sending vaccine, we had about little over 11% positivity that whole time. So you're getting where you need to go. And these testing sites were open to absolutely anybody. They were open to anybody across the city. There was not an insurance requirement. There was not a cost certainly associated. But we worked to place them in settings where the need was greater. And in fact, we also had very, very high. A lot of our outbreaks over the summer were in heavily Latinx communities, and more than half of the people getting tested at our community-based tests were Latinx. Very sort of statistically significant, and much more likely to come from sort of surrounding and communities that maybe didn't have as many resources. So for us, we think about that parallel between testing and vaccine, where we obviously make testing available to anybody, but we just as we make vaccine available, both of them. But when we think about where we're putting some of those events, or how we're especially pushing, marketing them, we want to make sure that they're getting where they're most needed. So we're doing the same thing with vaccine, looking at the data and saying, where do we need to go? And then working so much with community-based organizations, right? Like this is, we provide the vaccine and we support, but there are so many, community providers and then just, organizations that say, I want to help, I want to be part of this. And the vaccination events are by far the most successful when they come from, an organization or a group in the community. And so if there's a group that wants to do this, we'll bring the vaccine, basically.
That's just so great also that you're getting those neighborhoods coming out to those testing sites where it's most needed.
Exactly, And so we think, we're using some of those same approaches for vaccine, and, that's also been really pretty successful. You just want to make this as convenient as possible for people. So it's been really good to see. We are almost coming up on the end here. Let me just see if we've got another couple quick things. Oh, we got a shout out. Thank you, librarians. Your grab and go crafts are great. So
helping out all those families when they're kind of sheltering back in the day.
Yeah, absolutely. I think the last one. Okay, I'll take Christina Judge on Facebook here. It says, my 35-year-old niece just had COVID last month. Should she still get vaccinated at some point, and if so, when? Yes, she definitely should still get vaccinated. I'm glad she had COVID and recovered, but the vaccine is recommended even if someone has had COVID in the past. When you have COVID, you do get some immunity for sure. But it's thought, CDC says kind of 3 months is where we sort of think that immunity lasts. It probably lasts longer for some people, but it's thought to be overall less long-lasting, less predictable, and you definitely want to get the actual vaccine. So if she had COVID last month, she can go ahead and get the vaccine right now. There's not a waiting period, except that you need to no longer be infectious. So if you got diagnosed with COVID, you got to wait at least 10 days. But on day 11, if you're feeling good, you could go ahead and get that COVID vaccine. And actually, people who have had COVID are some of the people that I most want to encourage to get vaccinated, because there was something that put you at risk for COVID before, right? Whether you're an essential worker or whether you're out and about, or there's COVID in your social network. You, especially if you've had COVID, are who I want to really encourage to get vaccinated. And what you're doing there is just, again, teaching your immune system to fight off COVID without making you sick, or especially without making you seriously sick. And the data keeps being, better every single week as we look at it in terms of how protective this vaccine is against COVID, and especially against hospitalization and death. So, all right, I think we are just about at time here. Thank you again, Chris Brown. This is the commissioner at Chicago Public Libraries, and thanks for all the work that you and your staff have done, and thanks to people for putting in questions. We'll finish just with some good news here, and you can feel free to think about some good news you want to share too. So first, we do have a press conference later today. I don't know if that's good news or not, but at 1 o'clock, we'll be sharing some more details, both about just COVID progress here in Chicago, some more details about some of what's happening happening with vaccines. So feel free to tune in at 1 if you're interested in seeing some more. It is also Mental Health Awareness Month. There's a lot happening related for this. NAMI, National Alliance for Mental Illness, has been amplifying this "You Are Not Alone" message, which of course, takes on particular resonance with COVID. And there's a lot of work about thinking about how to reconnect and how to heal people in ways that they connect. And there's a lot of options for mental health resources, including on CDPH's website. I think let's start with mentalhealth.gov and sort of go from there. We'll talk some more. We're going to bring in a mental health expert soon and kind of talk some more about this too. Any good news you want to share?
Well, I think I was mentioning to you earlier, just we're so excited to be opening up along with the city. So we have our U Media spaces for youth reopened at your libraries. And then also as part of My Shy, My Future, we're going to have ambassadors. So these are going to be actual youth themselves that are going to be helping guide other teens throughout the city to opportunities for their summer.
Awesome. Yeah. Awesome. Good. Yeah. So just like everything else in Chicago, libraries open, getting more exciting stuff happening every single day. So thanks again for being here. We are not going to have Facebook on Thursday, but we will be back next Tuesday. And I think that's June 1st. My goodness.
Wow.
So time flies when you're having fun. Thanks for all your COVID questions. Please check out chai.gov/COVID if you want to learn more or we didn't get to your questions today. We'll see you next Tuesday.